Particularly, we'll talk about the community health platform, all the different stakeholders and actors that we can work with now. Health services are not alone in this endeavor. We speak of resilience. We've learned through a recent WHO policy that only about 60% of countries inform that they have mechanisms in place to engage with communities in their maternal newborn child health programs. If these mechanisms were in place, we wouldn't have to scramble now. We wouldn't have to scramble in outbreaks. We could build upon the relationships there and work together to address different problems and find solutions, including identifying and addressing the access barriers. We're facing many challenges. Governments, communities, households, individuals have really difficult decisions to make. We're talking now about communication. Some homes may not have computers. Everyone's promoting digital access. Some homes may not have computers or internet access. Not everyone has a smartphone, or only one person in the house may control the smartphone. When I move to, if I'm doing home visits, how do I ensure privacy? Everyone feels there's an information overflow. We need to think about our community health workforce, how to protect them, remuneration for them, and address their fears of transmission. There's many access barriers to address.
Annie, thank you so much. I'm just going to say this is about 10 seconds.
I'll finish that in 10 seconds. So some basic skills will be our most important ally in these moments, including our ability to coordinate across different programs and actors, our ability to communicate with staff and with communities, and our ability to dialogue and engage with stakeholders and communities so that we are all working towards our common objectives. And I hand over now to Tapiwa. Thank you.
Thank you so much, Annie. Just really quick, I'm going to, just for anyone who joined late, we had a lot of people came in. That's Annie Portela, Department of Maternal, Newborn, Child, and Adolescent Health from the World Health Organization. Thank you, Annie. And next we have Tapiwa Mukwashi, Senior Manager from Supply Chain from Village Reach. Thank you, Tapiwa. Go right ahead.
Thank you. There's some slideshow on the slides, and I'll ask that you just show all of them. Thanks, Annie, for giving this highlight in reference to the importance of community health workers, community health, and the different channels through which the community health services are delivered, sometimes at the health facility, and in other cases in the communities where people reside. People talk a lot about the importance of ensuring that community health workers continue to provide the routine services, because just because there is an emergency, it does not mean that people are not going to have the incidence of malaria, of diarrhea, that they normally do in those events when there is no COVID. In the countries where we work as Village Reach, in Mozambique, in Malawi, in the DRC, and in Liberia, where we're working in partnership with Last Mile Health, we see that community health workers are most effective when they are adequately equipped with the enablers for them to do the work they do. Community health workers need the medicines. They need, in emergency periods like this one, an increased volume of personal protective equipment that allows them to protect themselves and not be carriers of disease, that allows them to do their jobs more effectively. To give you an insight into just how important the community health workers are, a recent research that was published by the Community Health Acceleration Partnership has given us some insightful statistics. For instance, that we've close to 1 million community health workers across the 24 countries in sub-Saharan Africa, which were involved in the research. And these close to 1 million community health workers serve a population of 400 million people. Really, this means women giving birth, young children that are facing different conditions. And being able to provide continued services to a population of 400 million people, there are certain requirements in terms of the PPEs, personal protective equipment, that is required. The estimate from this particular research has indicated that we need close to $100 million US to be able to sufficiently provide PPEs to this population over a 12-month period. But providing PPE fundraising for this PPE and providing it over a 12-month period is not enough. We have got to be able to sustainably supply and resupply community health workers with the medicines and the equipment they need. And to be able to do this, community health projects need to be integrated into the national health systems. They need to be integrated into the national supply chains, which says when countries are forecasting or determining the requirements for what they will need to use in hospitals, in health facilities, they need to include what requirements will be needed for use by community health workers in the communities they serve, communities in which they serve 400 million people. The significance of including community health workers in this national level planning and national level coordination, I will exemplify by saying in Liberia, in a focus for the PPEs for the country, 39% of the required PPEs will be used by community health workers. And the importance of ensuring that these are included in the supply planning allows for there to be a budget allocated for this, a budget not only for procurement, but a budget for the logistics that is involved in storing and distributing these PPEs. We want to make sure that community health workers are included in the forecast and supply planning for the other medicines that will be required for them to continue providing routine services during this period. You will see that across the 24 countries that were included in the particular research that I have referred to, the levels of integration are low, which sees to it that a bulk of these community health workers receive most of the medicines and protective equipment from parallel programs run by NGOs. Whilst this is effective, whilst this helps solve a problem right now in terms of accessing supplies and medicines, this is not sustainable, and we need to be thinking into the future. We have seen also in those circumstances where community health workers have been able to get PPEs, sometimes they have arrived late, sometimes they have not arrived at all, mainly because they are being sourced from international sources, procurement sources. Close to 60% of the world's PPE comes from China, and we've all witnessed how the spike in demand, which was not followed by a spike in supply at the immediate period, resulted in massive shortages. And for us and countries and health systems to be more resilient in terms of continuing to provide services during difficult times, it is very important that we start thinking and talking about diversifying the sources of supply. Now there is increased communication around how we should procure locally to supply local markets. We should promote local manufacturers to be able to produce some basic PPE that will allow the work to be done now, whilst we are waiting for maybe the international procurements. We are talking more about strengthening regional supply sources so that the lead time to supplying and resupplying projects, both community projects and health facilities, is done in a short space of time. But above all, supply chains basically move money, and to be able to move money in the form of products along the supply chain, we've got to budget more for these supply chains. We have a number of projects that are currently being promoted right now. For instance, we have the direct relief supply chain fund that is distributing PPEs, masks, shields, gloves across 24 countries. And such initiatives need to be supported, but they should also, in a way, strengthen local systems. They should work through local government infrastructure, use government storage, government distribution mechanisms, allow for coordination in country between the government and the different partners that support it. We have projects that are being done, for instance, through the African Union to develop applications that allow for visualizing supplies that are in the pipeline globally coming to Africa, and allowing this information to flow to governments, to flow to organizations that support governments. All these initiatives should be supported as they lead to improved performance of the supply chains, because where there are no products, there are no programs. When there are no products, community health workers do not go to the field to do the work they must do. We will see to it that nurses strike, they have work stoppages because they are unable to continue with the work they do, and this poses a risk for women, children, and all those people that are supposed to be receiving services. So looking at the service provision with a supply chain lens is a very important aspect, because equipping community health workers provides a vital link to communities which are vulnerable in fragile settings.
Wonderful, wonderful. Tapiwa, I want to thank you for that. For anyone who has joined a little bit late, again, that was Tapiwa Mukwashi, Senior Manager of Supply Chain for Village Reach. We also have Annie Portela, Department of Maternal, Newborn, Child and Adolescent Health with the World Health Organization. I just want to thank Madeline Ballard for pointing out that we have people here. First, happy Canada Day, and we have people from over 60 people from multiple countries. And because of that, we're going to move right now into some small group conversations. And what I would like, there we go. Thank you, Jack. So this is the question for you. You're going to be moved. You don't have to do anything, into small groups. You're going to find yourself in an unfacilitated group. So you'll be with maybe 8 other people from many different places in the world with different expertise and experience. Have a conversation. It's going to be about 7 minutes. And really, the question is, what was most thought-provoking for you about the presentations you just heard? At the end of that small group conversation, you'll be brought automatically back here, and then we'll have a chance for discussion. So please enjoy this time, connect with these other folks. All of you chose this group for a reason. So find out what that reason is. Okay, wonderful. So everyone, welcome back. As everyone comes in, I just want to say I'm Mariah Roberts with The Difference. And again, we are very excited to have everyone here today. Quite a lot of people from all over the world. I hope you had a good chance to connect and talk about what resonated most with you from the earlier presentations. I would like to invite each of you, it could be repeat, but please share in the chat, what did you talk about? What were the highlights? What surprised you in the conversation that you had? So go right ahead, just jump in that chat, and just, it can be a phrase, it can be a term. What were highlights of the conversation? Don't be shy. While you're doing that, I also want to let you know the next bit of our time, and we have until 8:55, is really for you to be able to ask questions of our presenters. The way that we will invite your questions is that we would ask you to chat them in. So with this large of a group, we can't invite everyone onto the screen. And so the best way to share your voice now is to chat in your questions. We are monitoring that, we are scanning that, and we want to make sure that we get to as many of them as possible. So right off the bat, I'm going to ask Annie, we have a question about how do we best engage with community? What strategies have you seen in the field?
I like the way the question was phrased about how do we engage with communities, and I'm going to put a clause on the best. There's a lot of colleagues on the call, particularly from NGOs and who have a lot of experience. So I wish it was a session where we could open and allow you to help provide the response. There's formal mechanisms and there's informal mechanisms. And during these times, if the formal mechanism's in place, then let's not hesitate to use the informal mechanism. So when we're asked about mechanisms, again, there's always a consideration of national level, district level, and community level or facility level. And of course, there then you have different types of representation. At national level, there's more formal groups or women's groups or agricultural groups or different type that can represent people. And as we go along the different levels of the system, particularly when you get to facility level or district level, then we can hear more from voices and groups that more directly represent voices. We have formal mechanisms like community or health facility management committees. I know Dan Irvine's on the line, and he probably could say a lot about that from World Vision's experience. In the case you don't have these formal mechanisms in place, how does a facility manager work with local authorities? If transport's a problem, how do I work with local authorities and others to address that? What mechanisms, be it WhatsApp group, be it talking to leaders, be it working with traditional birth attendants, but what mechanisms are you going to put in place now so you understand why people are not accessing service, what are the constraints, and how together you can work them. I just wanted to say one point about the best practices, and it's something really that we're probably not going to crack during a pandemic, but we have a real problem with how these kinds of practices are documented and evaluated to be able to say best practices. There's lots of great experiences out there, and we're working really hard as a social behavioral community engagement community to support all of us in better evaluating and better documenting. So I just took advantage to throw in another side point there, but to me it's very related.
Wonderful, thank you so much. I'm going to move right into a second question. This one is for Tapiwa. What steps can colleagues take to integrate CHWs into national PPE planning if they aren't already?
So some of the important factors are that there is already an established structure in most countries with a supply chain strategy, with supply chain processes. They've established national quantification committees. They've established supply chain technical working groups, which are coordination mechanisms to allow for stakeholders with diverse interests to be able to contribute to shaping the supply chains. So it is important that to introduce or to integrate the community health aspects into those established mechanisms. One, community health worker organization need to participate in supply chain technical working groups. They need to participate in the national quantification committees. They are open groups and people can join and people can participate. And once this year has been done, in some leading countries, they have also gone on to establish supply chain technical working groups for community health worker organizations, which contribute to one, defining a list of products that community health workers are able to use. There are standard guidelines that the WHO provides for this. And once these are defined, they work towards defining some assumptions related to what community health workers need based on information from the field. They are already dispensing a lot of some of the commodities, so they have information, with the exception that the information that they are generating sometimes is not integrated into the information system for the national supply chains. A lot of people will refer to community health supply chains as black holes. Like if commodities go there, they just disappear. You don't even know where they've been used. You don't know how they've been dispensed. So to be able to address that, you need to integrate the information system so that information is more visible and people are more accountable. So integrating into the already established conventional supply chain is key. This integration is not going to be easy, because you will note that in most cases, I say supply chains are designed for convenience. They are designed to conveniently deliver commodities to health facilities, maybe because they are the most accessible by four-wheel drive motor vehicles. Beyond this, it becomes more difficult. You need people walking, you need motorbikes, you need much smaller equipment to be able to deliver. So supply chain design will factor delivering commodities to clinics. Being able to break this paradigm will involve one, advocating and integrating into the existing systems to allow people to better appreciate the role and the significance in terms of the population that's accessed by community health workers.
Thank you so much. I'm going to move to a third question, and then I know everyone's monitoring the chat. So after the third question, I'm going to invite both of our guests to just, jump in. And if you see some questions that really jump out at you, I'm going to invite you to take that initiative. This third question goes to both of you. Perhaps Annie, you could start, and that is, what approaches have you seen used to train community health workers in new COVID protocols, given the constraints about gathering in person?
What we've heard from countries is again, taking advantage of digital platforms. We've seen some photos of training in person and maintaining physical distance and the colleagues wearing masks. So there are, in fact, passive dissemination and active measures to support health workers in updating their knowledge and skills during this period. But again, as you saw, as you heard, or I mentioned it briefly, what we heard from a global survey, at least from maternal newborn health providers, is that often they're also feeling they're not able to have the information they need, or they haven't been oriented properly to do the tasks they do. So again, there's a lot to think about and to sympathize with programs and all they have to consider, but speaking to your providers and hearing back from them on what they need may be the best way forward then to decide how can we make sure they have the information and the support in order to provide the services we're asking of them. Over.
Thank you so much. Tapiwa, are you seeing a question in there that feels like it would be a good next step? I'll tell you, one of the things that, I wanted to touch on, I think it's come up in a few different questions, is just sort of how an organization might estimate what they need. So, what would be their way of estimating sort of as a starting point, their needs in terms of PPE?
So the easiest way would be one to use some ready-to-use forecasting tools, some developed by the WHO. We have Chai also developing one with Village Reach and Last Mile Health, also in the Ministry of Health in Liberia, developing some ready-to-use tools where you can just input your country-specific information. But sometimes these tools require a lot of background information. They need some customization. And so sometimes the easiest way is to develop your own algorithm, one that identifies the severity of the emergency that you are responding to in the country, the population that will be affected. You define the specific type of equipment that will need to be used in one of the key challenges is sometimes we make the assumption that the same PPE is what will be used across all emergencies, but we quickly found that in Liberia, the PPE that was required for the Ebola response was different from what you require for the COVID response. So defining that is very important. And once you've defined those, also defining the conservation factor. How long are you going to be using each piece of equipment for? Are you going to use a glove, a mask per patient? Are you going to use a mask per day? Are you going to use one mask over 3 days? You've got to conserve some of the scarce resources. But there are also some assumptions relating to guidelines on safety from the WHO. Are you going to use a glove per patient? So defining some of those commodity-specific attributes will help you build an algorithm on how much are you going to need in a week, how much are you going to need in 30 days, in 3 months, in 6 months, and in a year. And when you have started actually dispensing, you will have the benefit of hindsight and information, and you can already start to use consumption data to update your forecast and update your supply plans. So 2 alternative ways: use some ready-to-use tools or develop your own algorithm. Forecasting is both an art and a science, so you don't have to be absolutely correct. It's not mechanical.
I'm going to just follow up on that. And, you know, this is a question specific to product availability. And it's sort of in our last couple minutes because we're very close. And in fact, we'll just take maybe 2 minutes to answer this so I can get everyone pointed to the end of our session. But the question is, if you could do only one thing, what would it be to improve community health worker product availability? You had to choose just one. Tough question.
Make information around how the commodities are being used available. Information is the center along which all decisions will be made. Decisions on how much to replenish, how much to procure, when to supply plan, when should we delay an order, when should we expedite an order, when can we put commodities on sea, when do we need to put them on air. So you need information. So addressing that information piece and visibility around what community health workers are using solves the critical piece of the puzzle.
Wonderful. Thank you so much. We are basically out of time. I want to really quick thank both of our presenters. From the bottom of our hearts, this is a new day to be meeting in this way, and yet it really felt like we were able to connect and hear from you, Annie, Portela, Tapiwa, Mukwashi. Thank you. For everyone, you will go just click out of this meeting when you're done and go back to liveinthebalancesummit.org to continue to enjoy this fabulous summit. We appreciate you taking the time, adding your voice, and all of the work and passion that people have right now to support each other. Thank you very much.